Silicium is an element that's transferred from a pregnant woman to the newborn baby, and the baby uses it to grow bone, cartilage, muscle, and become a human being. So the mother transfers the bulk of silicium to the baby. Now, silicium should not be confused with selenium. There is absolutely no relationship between these two products. We leach out silicium every day from the day we are born to the day that we die through urine and perspiration. So we cannot hold the silicium that we have inherited at birth in our body. And there are traces of silicium present in certain food, such as long beans or haricot beans, bananas, oats, and hops, beer. But they are not absorbable by the human digestive system. So even if we drink oceans of beer, and if we eat rooms of bananas and haricot beans, we will only get a minuscule of the silicium in our digestive system, because the bulk of it will not get absorbed. So therefore, what did the human being do for so many millions of years? How did they survive? Now, one thing which is important is that nobody can get an overdose of silicium. Your body will take as much as it needs, and it releases the rest through urine and perspiration. So there is no danger of overdose for anybody. Now, what are the problems that the human being faces by leaching out this valuable element daily through urine and perspiration? The first thing that happens, we start having inflammation and pain. Some people are diagnosed with rheumatism, arthritis, but not everybody. The bones become brittle. We start having broken veins, broken capillaries, thread veins, and some people are diagnosed with osteoporosis, but not everybody. Nails can become brittle and dry. Hair starts falling out and becomes dry and loses its manageability. And the skin all over, from your body to your face, will start having fine lines, which are called dehydration lines. And if we don't look after it, it turns into wrinkles. And that's actually called aging. So, all these things can happen to us because every day we are leaching out silicium through urine and perspiration. In 1960, a group of scientists got together and they wrote over 2,500 research papers on silicium and the benefit of silicium on human health. They tried to make a tablet or a powder or a lotion or a potion that the human body could actually take and absorb and benefit from it. But unfortunately, they failed. So they decided to document and to put their 2,500 research papers on a medical database called PubMed. And any doctor, pharmacist, nutritionist, any medical person can go on the PubMed and actually read these research papers. About 20 years ago, the EU government contacted a laboratory, which I'm not sure if it comes across in the camera, called Dixie Lab in Belgium. This was a running laboratory. It It was a working laboratory. And they said, we have got all the research papers. We don't want you to spend any time or money on research. All we want you to do is to provide us with a liquid, a powder, a gel, that the human body can actually absorb this valuable element called silicium. So the scientists, some of them alive from 1960, some new scientists, got together, they started thinking, and they all worked for Textile Lab in Belgium. They knew from the research papers that silicium naturally is found in sand. It's very difficult to absorb silicium from sand, and that's why the 1960 project to make something that the body would absorb failed, but the research was done. So they thought, well, how else can they get the silicium? Because obviously we get the bulk of our silicium when we are born from the pregnant mother, and that is the best form of getting silicium in this world. But then what's the other way? There must be other ways. So they analyzed that not only human beings need silicium, but certain plants also, for survival, need silicium, especially stinging nettle and horsetail. So the scientists actually decided that if they analyze these two herbs or plants, they might be able to get closer to making this silicium for human being. They realized that the plants absorb the silicium from sand. In their leaves, they convert it to a soluble format that the plant can use. So part of the laboratory process was now done by the plant, obviously for their own use, not for us. So the scientists took the leaves of these plants, brought it to the Textile Lab in Belgium, and with a patented formula made liquids that the human being drinks and variety of gels that I will go over when I get to it, that we apply on the skin, on the body. In this formula, the molecules have been made with a patented formula, very, very small, smaller than a pinhead. And the molecules do not polymerize, so they do not attach together, means they don't become a big molecule. If it's a big molecule, it's difficult for the human digestive system and skin to absorb and benefit from it. So these molecules, which are very small, stay in small bits separate. They don't attach to form a big molecule. And that is the underlying success of this brand, Textile Lab in Belgium. So as soon as human being drinks the liquid and applies the gels on the skin, the human body absorbs the silicium molecule. And the key is absorption. Because if you don't absorb something, no matter how much of it you eat or you apply, it goes through the system and out. The key to anything is absorption. So therefore, the human body absorbs close to 100% the silicium molecule out of the liquids that we drink and out of the gels that we apply externally on the skin. But then, what is so important about silicium? Why go through all this money and research for silicium? The first benefit of silicium to the human body is that silicium is a natural anti-inflammatory. Silicium naturally reduces inflammation of any type in the human body. Inflammation can be rheumatism, arthritis, osteoarthritis, any form of inflammation because we have had an accident, a broken neck, a broken arm, a broken knee, a broken wrist, anything broken. Inflammation can also be because of surgery. When people have plastic surgery, they are inflamed. If you've had cancer and they've cut your breast or half of your breast, you're inflamed. If you've had hip or knee operation, you're inflamed. Plus, any inflammation from the ulcers, digestive inflammation, irritable bowel syndrome, which is IBS for short. Hepatitis responds very well to silicium because hepatitis is inflammation of the liver, and silicium naturally will reduce these inflammations that I've explained. When you reduce inflammation, you reduce pain. And if it's a physical inflammation, once you've reduced inflammation, you reduce pain, the patient starts moving better. This is one of the most important aspects of these liquids and gels. If you drink it long enough, it also prevents future inflammation. Now, we all know that there are millions of drugs in pharmacies and in chemists worldwide, but all drugs have side effects. Even an aspirin or a Nurofen actually causes digestive problems. People who take too many drugs, they start having ulcers, acid, constipation, because drugs can inhibit the formation of natural bacteria to digest food, and therefore you will have other implications. This product works, but is not a drug. As I said, it's organic, and it comes from the leaves of certain plants, such as nettle and horsetail. So there is no drug in these products whatsoever. The second benefit of silicium, we talked about inflammation, reduction of pain, aiding mobility, is that the silicium, especially when you drink it, it mixes with the calcium in the body, and it allows the body to regenerate its own bone and broken veins. So when you absorb silicium internally, your body responds. And this is by rebuilding bone, broken veins, broken capillaries, and thread veins. We have had very, very high rates of success in short spaces of time on osteoporosis. And all this has been documented in various health magazines, such as Natural Lifestyle magazine, in Health Science Institute, which is a newspaper written for practitioners by 12 panel of doctors, and in Choice Health and Wellbeing magazine, and issues of Optimum Nutrition magazine. These are verified cases which have been verified by their doctors, by hospitals, by osteopaths, by chiropractors, and by the patients. So we talked about rebuilding bone and vein and overcoming osteoporosis. Anything that rebuilds bone and vein strengthens the nails and allows your hair to be more manageable. It does not make you grow new hair. So if you're bald, you stay bald. But if you have even 2 hair on your head, you actually maintain that hair. Now, the third benefit of silicium, when we drink the liquid and when we apply the gel on the skin, is that the body, on absorption of the molecule, responds by generating natural collagen. Collagen is a protein that holds us together. It's like a glue. Collagen is important in the skin, not just on the face, but on the body, breast, chest, arms, legs, everywhere. So when you drink the liquid, either of the liquids, and apply the gel, which has to be applied on damp skin, clean damp skin, the body will naturally generate its own collagen. If somebody is young and they still don't have lines, within 3 weeks of the liquid and the gel, their skin becomes very plump, very fresh, very hydrated, and they look like they've had treatments or a holiday or something. And it delays wrinkles. Why? Because you're constantly generating natural collagen in your body, not just on the face, all over the skin, everywhere. And if you're old and you have deep lines, you should do a before picture and then an after picture. Because every week that you take a photo in between these beginning and end, you see that the depth of the line reduces. The skin becomes plump and hydrated and fresh, and the skin becomes firm. Because every day you are generating natural collagen in your body. Collagen is firming and hydrating on the skin, but it's not working on the muscle. So if somebody is old and the neck muscle has collapsed, or the eyelid has collapsed, you're not going to get the muscle up. That is done with other beauty treatments, such as non-surgical lifts that we do with electric currents. The silicium allows you to generate collagen to work on the skin, not on firming the muscle. But collagen is not just for the skin. Collagen is in the arteries of the heart. So by generating your own natural collagen, you're actually working on arteries of the heart. It's very good for unclogging the cholesterol in the heart. And it's used heavily for heart patients, heart attack, pre and after. Collagen is in the cartilage of the knee. So if you have problem with your knees or your hips, especially by drinking the liquid and applying the gel on damp skin, you are rebuilding the collagen, which means rebuilds the cartilage. And therefore you can actually cure a patient. So the collagen is very important both for health and for skin and obviously looks and beauty. The other aspect or benefit of silicium is that silicium is a carrier. Silicium acts as a driver of a train. Imagine the passengers in the train can't get out and can't get in. In other words, the doors are locked. So you're sitting on this train and the driver is silicium, but the doors have got a fault. They don't open, so you can't get out and you can't get in. Wherever that silicium goes in your body, the passengers go with it. What do I mean by passengers? In one of our liquids, which is called the Articulosil, the products have two names because Textile Laboratory, which is based in Belgium, makes two brands. One brand is the Vitasil brand, the other brand is the Textile brand with the name of the laboratory, same name. So when I specify the names of products, I will give you two names. This is Articulosil liquid or articulation liquid. Both are the same product, but different brands. In this product, we have MSM, glucosamine, and chondroitin. Now, glucosamine, chondroitin, and MSM are the passengers of the train, and the driver is silicium. Wherever silicium goes in the human body, the passengers go with it. So, what happens is, because silicium is a very small molecule, and it's unpolymerized, it doesn't stick together to form a big molecule, it stays small and separate. As soon as you drink this liquid, you absorb the ingredients with the help of the silicium. Now we have hundreds of tablets for glucosamine, chondroitin, and MSM on the market, but not many people have been cured by those. Partly because they cannot get close to 100% absorption and hence benefit from those products. But in this case, which is a liquid that you drink, the silicium carries the glucosamine, chondroitin, MSM into the body. And it's the silicium that allows the absorption close to 100% in the body. That is underlined in red, that's key. And that's where you get the benefit from everything. So we're on the last point and we'll move into the products. Silicium acts as a carrier, and most of our gels, which I will be talking about, have got silicium but with added ingredients. And the reason the gels work and they actually get absorbed close to 100%, and that's why you get the benefit, is because silicium carries those ingredients deep into your body. Whether you drink the liquid or apply the gel is the same thing. And you actually benefit from those ingredients as well. And that is a very important point about silicium. And last is that silicium balances, provides an equilibrium in the cells of the human body. All of us are made of billions and billions of cells. Each cell in our body has a negative charge and a positive charge. When somebody is ill, any illness, the negative and the positive of the cells are unbalanced. When you drink the liquid, what happens is it brings an equilibrium. So even though we're not making a claim on all diseases, it actually helps with many other diseases that the Excel lab hasn't made a claim, such as thyroid problem, menopausal problems, hormonal imbalance, diabetes, and many other problems. But we cannot make a claim. So all we say is that it helps with other ailments and diseases by providing an equilibrium between the negative and the positive charge of the cells. Any contraindications? There are no contraindications at all on this product. If anything, as I just told you, it brings an equilibrium to the negative and the positive charge of the cell. So actually, if you are taking medication for other diseases, high blood pressure, low blood pressure, heart problems, diabetes, menopausal problems, any problem, you find that your other problems will actually get better, but I'm not making a claim on other problems. So there is no contraindication with you taking your liquid first thing in the morning before breakfast and then taking your medication. The only thing that we say is a pregnant woman, whilst they're pregnant and whilst they're breastfeeding, should not drink the liquid. They can still use all the gels on the skin, but they cannot drink the liquid whilst being pregnant and whilst breastfeeding. However, after they finish breastfeeding, or if they're not breastfeeding after the pregnancy, they need to drink 45 ml a day of the clear silicium liquid at least for 3 months, because the pregnant woman transfers most of her silicium when they give birth to the newborn baby. And that's why women after pregnancy are dehydrated, hair falls out, nails become dry and brittle, and in general they're very sluggish. People think it's because of lack of sleep, but it's actually, apart from sleep, it's because they've lost majority of their silicium to the newborn baby when the baby is born. So the only contraindication is liquids should not be drunk by pregnant women and if they're breastfeeding. Afterwards, they need a lot of it. We are now going into individual products. The first product that I'm going to talk about is the one I showed you before, which is called Articulosil liquid, or the other name articulation liquid. This is silicium with glucosamine, chondroitin, and MSM. This is the liquid that we give to any patient who has got osteoporosis, arthritis, inflammation of any type, osteoarthritis, or any form of inflammatory condition, as I said before, because of IBS, ulcers, hepatitis, anybody who's had an operation, anybody who's had a broken limb of any form, or in general inflammation and pain. So this is more of your cure. Now the way you drink this, each bottle comes with a measuring cap, and the measuring cap has got a measurement on it. So everybody should drink first 15 ml on an empty stomach before breakfast, a second 15 ml anytime during the day, but doesn't matter if you've eaten lunch or any snack, and a third 15 ml before sleeping, doesn't matter if you've had dinner or food. That means 3 15 ml per day. That's 45 ml a day. Each bottle is 500 ml. 500 ml divided by 45 ml gives you 11 days. So you have to drink one bottle for the first 11 days, the second bottle for the second 11 days, and the third bottle for the third 11 days. So it means in 33 days you drink 3 bottles. That is very important because all of us are leaching out silicium every day through urine and perspiration. And there is no tablet, no food, no way of us actually topping up the amount that we're leaching out every day. So when people start with these liquids, they have to drink 45 ml a day, which means a bottle every 11 days, which means 3 bottles the first month. That is crucial. If people have got long-term arthritis, rheumatism, osteoporosis, or long-term problems of IBS, hepatitis, or gastric problems, any inflammation which is long-term, has been there for a long time, we cannot specify for how long they have to drink 3 bottles a month. But the patient will feel themselves that their inflammation comes down, their pain comes down. And if it's a physical problem, they move better. If it's a digestive problem, they will feel better. Once the patient feels better, you can reduce the same bottle to 15 ml before breakfast and 15 ml before sleeping. That means 30 ml a day. And once they're completely well, you can just give them 15 ml before breakfast for life. But why for life? Because you're leaching out silicium every day through urine and perspiration, and you have no other way of absorbing this silicium from food, from tablets, from vitamins, or anything. So therefore, everybody needs that silicium liquid daily. Now, the second point is that what if somebody doesn't have long-term history of arthritis or osteoporosis or any form of inflammation? They've just had an accident and they're inflamed, or they've just had cosmetic surgery, they're inflamed, or part of the limb has been cut due to some medical condition. Those people haven't got a root, they don't have a disease which is rooted. It's purely because of an operation or an accident. Those people should, in general, we cannot be specific, cure within 4 to 6 weeks. But they have to drink the first month 3 bottles, possibly the second month 3 bottles. At that point, that patient should be better. From the knowledge we have and from the experiences we've had, patients without background, deep background of inflammation, arthritis, rheumatism, and generally gastric inflammation for a long time, generally get better after 4 to 6 weeks. So those patients have 3 bottles the first month, possibly 3 bottles the second month, cut down to 30 ml. Once they're cured, they can actually put this bottle away and move to our clear liquid, which is just silicium without anything added. So, I just summarize. People with long-term history of rheumatism, arthritis, osteoporosis, inflammatory condition, hepatitis, ulcers, IBS, have to drink this liquid longer. But I cannot specify how long. They will feel better. You reduce it to 30 ml, reduce it to 15 ml before breakfast, keep them on this bottle for life. People who've got the pain, the inflammation, because of accident, because of operation, but not because long-term history of problem, they can actually stick to this clear liquid, which is pure silicium. And they start, preferably, again, 3 bottles the first month, and thereafter just 15 ml before breakfast for life. So this is more your prevention and maintenance liquid. This one is your cure. And we only have 2 liquids. Now, in conjunction with this liquid, we have got a gel by the same name. It's called Articulosil Same name as the actual bottle for articulation gel, and it's got exactly the same ingredients. It's got the silicium with MSM, glucosamine and chondroitin. The liquid we drink, the gel we apply on the body, on damp skin. So what we do, we take a towel, we make it wet. We apply it on the area where you've got the pain.